Hey guys, this is Manu, Kalia, physical therapist and Ayurveda herbalist. Okay, so in continuation of my last video, which I talked about the difference between tendonitis and tendinosis and why tendonitis is the incorrect term that's used. So just to give you the basics on some treatment ideas for repetitive tendon injuries like patellar tendonitis, quadricep tendonitis, Achilles tendonitis. That's what they're called. And as I mentioned in my last video, so go check it out. The last video I give in-depth explanation of why the correct term is tendinosis or tendinopathy. Okay, so regarding a little bit about treatment, the general picture of treatment, what you want to aim for with these type of chronic injuries, and what works and what's successful. There are a few basic things you got to keep in mind, and that's if you follow that, is going to help you heal that tendon and prevent you from having those repetitive injuries. Okay. So first of all, as I said, it's not tendonitis. Okay. The correct term is tendinosis, which is a degeneration of that tendon, wear and tear, with some thickening, swelling, pain, and weakness and tightness of that tissue, of that tendon. So what we want to do is, since we said in the last video that there's a thickening of that tendon with all sorts of collagen fibers that are cross-linked and not moving properly. So there are adhesions that have formed, or you can think about it as scar tissue, okay? So we want to break down that tissue so it aligns better, so it lays down better. So that's where scar tissue mobilization or cross-friction massage or deep tissue massage, all those kind of things, myofascial release, all those things are going to be really helpful to break down that scar tissue to allow it to move properly, okay? The second part that will be also improving the circulation to that tissue. So there's a lack of nutrients, blood flow, and circulation in that tissue. So we want to increase circulation to facilitate or help that healing process. Okay. So all the things that are going to go in improving circulation. So massage, of course, will help. Using heat will help. There are herbal oils. There's also oral herbal formulas and things that you get, supplements that are available that'll improve blood flow and nutrients or facilitate that process going into that tissue to improve the health of that tissue. Reducing the swelling. So all the things that we mentioned with application of heat, massage, and movement, of course, will help reduce the swelling too. You want to remove blockages. In Eastern medicine, in Ayurveda as well as traditional Chinese medicine, anywhere there's pain, there's a lack of proper movement, or after injuries, you often have blockages which are preventing circulation or blood flow or nutrients going into a tissue, as well as blockages of chi or energy. So which will not only cause pain, but also prevent the tissue from healing properly. Okay, so we want to, all these things are geared towards removing those blockages. Remove the blockages so you have nutrients going into that area, you have blood flow going there, you have proper flow of communication or chi or energy going into that tissue also, so it can function normally, it can heal properly. Okay, and then of course pain. So all these things are working towards reducing the pain too, which is one of the main reasons why somebody comes to see someone like me, is because they're having pain with running or walking or squatting or their daily activities. So all these things, externally doing the hands-on stuff to internally taking things like turmeric or other herbal supplements or omega-3 fatty acids, and also externally applying herbal oils, poultices, and liniments, as well as heat application or warm water, Epsom salt soak. So all those things are geared towards reducing the pain too. And finally, after this step is going on, improving the strength of the tendon and the flexibility. So then working on that building of that strength of that tendon, the exercises, right, and targeting flexibility so he has good mobility. Okay, so this gives you a general idea of things you want to think about, how you want to approach this problem. Okay, and this is a very common problem that a lot of people suffer from. Okay, but it gives you a better understanding of what you need to do to get that problem under control. All right. So I'll post some more videos on treatment ideas, and there's tons of information I have on my site, so go check it out. Lots of articles, lots of videos on all sorts of injuries, both the Western as well as the holistic Eastern perspective. If you have any questions, leave a comment, and stay tuned. We got our program coming up pretty soon. It's going to be pretty awesome, and it's on those of your athletes and runners are going to love it, and so make sure you keep checking up on the site. And subscribe to the channel and keep watching. Thanks, guys.